for a history. Again, there is no specific screening question that is asked of the donor. All of this has to be voluntary information that the donor presents. So we are looking at the different possibilities as far as strategies in a risk assessment. If it does prove that XMRV is a causative agent for disease in man, that we will have procedures in place to mitigate the risk, and we are trying to communicate very effectively with a lot of our partners, and include many of you on the advisory committee. Next slide. Some of our communication that has gone forward is that we have put forward questions and answers to our various websites. Again, because CDC is the primary source for having a lot of the information for the chronic fatigue patients. We have worked very closely with CDC, and I have to say it's not just CDC. We have collaborated. We have any of our statements, we have looked to our other agencies such as the NIH and FDA along with CDC, and have looked at the different the wording of our questions and also the information that is put on the website. So we do have a link that has been established with the Chronic Fatigue Syndrome Advisory Committee. There's questions there. It will then go directly to the CDC site, and the CDC site has a statement that there's a question that says, should an individual with diagnostic chronic fatigue syndrome donate blood? And the response is, at the present time, there are no specific recommendations to defer donors who have chronic fatigue syndrome. However, FDA regulations require that a donor should be in good health. Medical directors at blood collection centers should exercise judgment in determining whether individuals with a history of chronic fatigue syndrome are in good health at the time of donation. Also, there are questions and answers posted at NIH on the NCI website. Next slide. One of the other documents that I did provide for you is a fact sheet. Last August, the AABB, Transfusion Transmitted Disease Committee, put together a supplement to the journal Transfusion, in which they identified various emerging infectious diseases, or just infectious diseases that are known to be a threat to the blood supply. And they have identified those in different color codes, sort of like the DHS has with the security of the country. And so it really is very well done as far as putting together all the risk factors and the transmission. The AABB started working on a fact sheet in December, and this is the second version. It was dated April. It has the updated articles, journal articles that have come out since the first science paper. And I give that to you. Also, it's available on the AABB website. Again, some of the things cannot be said with definitive statements, but at least it gives clinicians a good handle on where we are at the current time with XMRV. And we will continue to be working with AABB on the communication mechanisms that they will be putting out, and then also within the government. And as I promised you the last time I was here, as we develop more information, we will make sure that it gets on the Chronic Fatigue Advisory Committee and also to the various links within the other agencies. Let me turn to the next slide, and that is that we do have an international workshop, the first international workshop on XMRV, pathogenesis, clinical, and public health implications. This is being organized by Virology Education. It will be at Lister Hill Center Auditorium on September 7th and 9th, and you can see the objectives there. Since it is on NIH, there is some relationship with NIH and this organizing body, the Virology Education, and many of us have been asked to participate on the scientific committee for this upcoming workshop. I think this is great as far as being able to put people together as far as some of the information that is currently available, and I do believe that within the next several months there's even going to be more information coming available, that we do need to have a forum to be able to address some of these issues. And with that, I'll just end my presentation and ask you if you have any questions for me.